Nom Nom delivers fresh food with whole ingredients backed by veterinarian science. Science tells us that a dog's health starts in the bowl, so improving their diet is one of the best ways to help them live a long and happy life. Nom Nom's food is full of proteins your dog loves and the vitamins and nutrients they need to thrive. All you have to do is order, pour, and serve. Ready to make the switch to fresh? Order Nom Nom today. Go to https://trynom.com/curveball and get 50% off your first order plus free shipping. That's https://trynom.com/curveball. Plus, Nom Nom comes with a money-back guarantee. If your dog's tail isn't wagging within 30 days, Nom Nom will refund your first order. No fillers, no nonsense, just Nom Nom. Welcome to the Living the Dream podcast with Curveball. If you believe, you can achieve. Welcome to the Living the Dream with Curveball podcast, a show where I interview guests that teach, motivate, and inspire. Today we're going to be talking about sleeping issues and sleeping disorders, as I am joined by author and board-certified internist and sleep medicine specialist, Barry Krakow. Barry is an author and he specializes in dealing with sleep issues, so we're going to talk all about that. And if you know of anybody that has some sleep issues, Barry's the man. So listen up. Barry, thank you so much for joining me today.
Well, thank you for having me on the program. Really appreciate it.
Well, why don't you start off by telling everybody a little bit about yourself?
Well, let's see. Should we start with the science or should we start with my own sleep? Because I've had sleep problems ever since I was about 13 years old. It took close to 35 to 40 years to figure them out. And once I figured them out, it was life-changing. And so it's a very, very remarkable thing that sleep can have so much impact on individuals. I started out in internal medicine, emergency medicine, addiction medicine. Finally, in 1988, I started getting involved in sleep medicine and discovered that was really the home for me, the field that I knew was going to give me the most satisfaction, and not to mention treating my own sleep problems. And it has been life-changing. In fact, I'll tell you a very short anecdote that from about the age of 13 to 48, 35 years, I had the desire to nap pretty much every day. Some days I napped, some days I didn't, but I had a desire. There was that level of sleepiness. In 1998, I began treatment for one of my sleep disorders that turned out to be the granddaddy of all of them, called sleep disordered breathing. We know it by names like sleep apnea or upper airway resistance. And when I treated that condition, not only did my napping behavior and desire stop, but my energy level was so different that I left the current job I was at to open up my own sleep research center, to open up my own sleep clinical medical center, and also wrote 2 books about sleep disorders. And I just know that that took about 4 to 5 years. I just know that never would have happened had I not treated my sleep problems.
Okay. Speaking of poor sleep, you say that poor sleeping damages the brain. Tell us, explain that to the listeners.
That's correct. And that's a great first starting question, because we have to understand that in society, there's tremendous disrespect for sleep. People really don't get sleep unless it's really rotten. And then those people tend to get it and they seek help. But most people don't realize that sleep is kind of like a vital sign, like blood pressure, pulse, and so forth. And unfortunately, society and the media and even science doesn't explain sleep in a way that would make people more interested. And so the question you ask is really so crucial because we now understand that when you go to sleep at night, your brain actually gets washed. We call this, good brainwashing. So if you say, what's it being washed from? You go, well, what does your liver do 24 hours a day? It detoxifies bad chemicals inside your body or waste products. Same thing with your kidneys. It turns out the brain will do this cleaning, but it does it best when you are sleeping. And then here's the big news that people have to understand. It's not just any sleeping. It's really high quality sleeping, which we call the deepest sleep that you can get. And so when people ask the question about why should I respect sleep? Why should I think about it as something important in my life? The answer is, well, if you get good sleep and really deep sleep, that means your brain is actually going to work better every single day. Your memory, your concentration, your attention is going to be better. You're going to be better at the work you do. You're going to be better at homemaking. You're going to be better at raising your children. Whatever you need brain power for is going to be better because you got a good night of sleep. And notice, Curtis, I didn't mention yet how many hours you sleep because that's not the secret. The secret is all about the quality of your sleep. Again, unfortunately, the media wants to talk a lot about numbers of hours of sleep. That's not where the action is. It's all about the quality of your sleep.
Okay, so that 8 hours of sleep thing really doesn't matter?
It's not so much that it doesn't matter, it's that it's often the wrong number because it's not personally tailored. In medicine today, more and more doctors are trying to adopt this idea of personally tailored medicine, like what is right for you. Don't tell me about the rest of the people, the rest of the population. Tell me what is the best treatment for me, for you. And this 8 hours thing doesn't talk that way. It's like saying, oh, well, everybody should get 8 hours or everybody should get 7 hours. And really, it turns out the number of hours you need is based on the quality of your sleep. If you get great quality sleep and you only need 6.5 hours of sleep, and by what do I mean by only need? I mean, you get into bed, you go to sleep, you wake up without an alarm clock, you don't need caffeine to start the day, and you go, well, I feel really good. I've got a good head of steam. I've got energy. I've got momentum. That would suggest that that person only needed the 6.5 hours of sleep. Somebody else could be different. They could need 8.5 hours of sleep. Many teenagers need more sleep. Many women, at least in the first several decades of life, may need more sleep. So there are certain variations, but my point is each individual can find out the number of hours they need to sleep by first figuring out if there's something wrong with the quality of their sleep. Does that make sense?
Yes, that makes sense. So talk about some of the breakthrough treatments to treat the different sleeping disorders that's out there.
Sure thing. The most important point to remember about treating a sleep disorder is to ask, what is it that we're treating and expect to get better? So, for example, we've already talked about some things about quality of sleep, talked about how the brain gets cleaned. What your listeners want to hear is that, well, what does exactly mean if you have a sleep disorder? What's happening to the brain when you have a sleep disorder? The most common sleep disorders are insomnia, nightmares, sleep breathing conditions, leg movement conditions. And by and large, all these disorders are doing something to your brain during the time it should be sleeping, during the time it should be, getting clean properly in terms of the brain. And we call this phenomena sleep fragmentation. And that just simply means that you're waking up a lot during the night, but you may not even know it. And you say, well, how could that be? How could you not know that you're waking up a lot? Well, it turns out that if you are only awake for 15 seconds or 30 seconds or 60 seconds, then you could do that hundreds of times in the night and yet never know that you did it and feel exhausted the next day. So when we talk about the treatments, and we'll go through these different disorders if you like, we'll go through nightmares, we'll go through insomnia, sleep disordered breathing, and so on. We first want to clarify, is the person's brain having this problem of being awakened during the night? And so I think we should start with sleep disordered breathing because that's the most common of the disorders, and that produces the worst sleep fragmentation. In other words, it's breaking up your sleep all night long. It also causes your oxygen levels to drop. So just as an important reminder, everybody probably has heard the word sleep apnea before, but most people may not be aware of how much mental and physical damage is caused by having a sleep breathing disorder. I mentioned the sleep fragmentation, I mentioned the oxygen, but really there's a lot of stuff that goes on. I'll give you two really opposite examples that you might not think would be relevant, but they are. People who have depression, anxiety, post-traumatic stress, they seem to have a lot of these sleep breathing disorders. And the sleep breathing disorder makes the depression, the anxiety, and the PTSD worse. That means if you treat the sleep breathing condition in a PTSD patient or a depressed patient, there's a very good chance their PTSD and their depression is going to get better. So that's a mental, psychological side of things. And yet, if we go to the other side of the equation, your body, the physical, nature of your being, sleep disordered breathing causes high blood pressure. It causes trips to the bathroom at night. It causes heart arrhythmias. It actually makes your heart more susceptible to heart attacks and heart failure. It affects your kidney function. I think you get the point that these disorders, this particular one, sleep disordered breathing, have far-reaching consequences that if you haven't been paying any respect to your sleep, you could just imagine it's something simple like, well, I didn't get enough sleep last night, or I'm working too hard. I don't have time for sleep. And you could be thinking that way and not ever stepping back and asking the question, how rested do I feel in the morning when I get up? And so when we start any treatment for anybody, whether it's nightmares, insomnia, sleep disordered breathing, leg movements, that's the number one question. We want to know, well, if we treated you, can you tell me what's different? Do you feel different the next morning after you've tried this treatment? Does that idea make sense to you? Or do you think I need to clarify that for the listeners?
Oh no, I think it makes sense. One
Great,
thing
great.
one thing that you can clarify for the listeners is, you talk about how sleeping pills almost never work long term. And I'm sure there's a lot of people out there that use sleeping pills. So why do you feel like they don't work long term?
Yeah, that's a great question because you asked before about what are some of the good treatments. Well, it's not such a bad idea to start with some of the bad treatments. Sleeping pills don't work largely because they're not actually treating the condition they said they're supposed to be treating. For example, if you have insomnia, the biggest reason you have insomnia is because you've built up certain stresses, worries, tension, anxiety about what's going on in your life, and you haven't really learned to deal with things in a way that are as healthy as it could be. And so you end up with insomnia, and then a doctor who doesn't know a lot about sleep writes a prescription, says, well, take this. Now, it's true. If you had a really bad life experience, you went through a divorce, somebody in your family died, you had a financial crisis, easily you can make an argument, give somebody a sleeping pill for a couple of weeks if that's what they need. I don't object to that at all. That's a very good use. In fact, sleeping pills done the right way have actually prevented suicide. So it's not like we throw the baby out with the bathwater. It can be used in certain circumstances, but long term, it is rare that sleeping pills are a good option. And that's unfortunate because so many doctors in different fields of medicine, healthcare, and so forth just keep prescribing, pills after pill. And yet these pills are not solving the sleep fragmentation problem I described for you. Moreover, our research and that of a few others has shown that most people who are using sleeping pills for a chronic insomnia problem actually suffer a sleep breathing disorder that nobody's ever spent the time with them to figure out, or gotten it diagnosed in a sleep lab or on a sleep test and treated them. And so here they are going years. People can be on these pills for years and never be told, well, by the way, that's not actually treating your condition. That's just trying to knock you out so you can get some sleep. And the problem there is the person has done it for so many years. They'll come back to a new doctor or the same doctor and say, well, this pill isn't working anymore. So can I get a new pill? Now, unless that doctor has spent some time educating themselves on the latest news and information about sleep, they're not going to say, oh, wait a second, we got to change course here. Let's get you tested in a sleep center. Let's reevaluate. What instead they'll hear is, oh, I just spoke to somebody and I just read about this new drug for insomnia. Oh, let's try that one. And again, it's not really treating the condition except in a very small proportion of people who may need these drugs. Again, I don't want to say nobody can benefit from them. I'm just saying it's not a good long-term solution.
So post-traumatic stress disorder, we hear a lot about that all over the place, but you call it, or say it should be called, post-traumatic sleep disorder. Why do you say that?
Exactly. Because if we look at some of the worst cases of sleep problems, then we are talking about trauma survivors, sexual assault survivors, people who've been through war, people in car accidents where there's tremendous bodily injury and then psychological damage. So PTSD is a very big deal. And our research teams were probably the first in the 1990s, which is 30 years ago, to point out that these people have very complex sleep disorders that are making the PTSD worse. And the sleep disorders take on a life of their own. And what does that mean? Well, if you go back in time and you look at what's written in psychological textbooks or mental health books, or you talk to psychotherapists or psychologists, psychiatrists, they'll say, well, of course the PTSD patient has sleep problems. They have PTSD. They were traumatized. Of course they have nightmares about their trauma. Of course they have insomnia. Why are you suggesting something different here, Dr. Krako? And the answer is quite simple. We began our research in the treatment of chronic nightmares and discovered that most of these patients didn't just have nightmares. They had insomnia with the nightmares. They had sleep breathing disorders that were pretty much invisible to the people trying to treat them and evaluate them, meaning mental health professionals. They have restless legs and leg jerks, yet another disorder. So you're talking about a typical PTSD patient has gone to different doctors for a decade and getting all kinds of psychotherapy, all kinds of what are called psychiatric or psychotropic medications, the antidepressants, the anxiety drugs, and so on, even the antipsychotic drugs. They're given all of these drugs and told, well, these drugs are going to help your PTSD. And by the way, some of them will help your sleep. And if they don't help your sleep, well, we've got other drugs that can help your sleep. It's all about pharmacological approaches when really each one of the conditions I named, nightmares, insomnia, sleep disordered breathing, restless legs and leg jerks, all of those conditions are independent disorders actively involved in the PTSD process to make it worse. Now, when we've done training, by the way, in the military, we've gone over to many bases all around the world teaching mental health professionals to start focusing on the sleep disorder. And you know what we've learned? These therapists are beginning to tell us that When they start with a sleep disorder treatment, the patient's eyes light up like, well, this is great. I don't need to spend time talking about the trauma right now. I'd love to get some sleep. I'd love to have my insomnia better without drugs. I'd love to have my nightmares reduce or go away. And that's what they began doing, because there's some very intense treatments, psychotherapies that are offered for PTSD. And I'm not knocking them. They're good therapies, but it's timing. A lot of people can't do them at certain times in their timeline, I should say. Some people just are not ready for them. As you may know, some PTSD treatments involve trying to relive the experiences to become desensitized to it. And yet we now know that nightmares, insomnia, sleep apnea, and so forth, they can all be treated in a PTSD patient even before they're doing major PTSD therapy. But that option is not widely known. And that's why I think the term PTSD sleep disorders or post-traumatic sleep disorders is a very accurate description and should be embraced by more people in healthcare.
Okay, well, talk about the impact of sleep on suicide. I know you kind of mentioned that before, but kind of go into more detail about it.
Right, right. Let's talk about that, and then we can come back to some of these treatments too, because they're very, very important for something like depression and suicide. The part about suicide that's most concerning is back about 15 years ago when I first started working on my new book. And by the way, I just published a new book called Life Saving Sleep. And in the preface of that book, I actually talk about this problem that if you look at what happened in the late 2000s, when more veterans were returning, or active duty veterans both, were coming out of the military or returning from the Middle East, it became very obvious that the suicide rate was increasing. People became more aware of PTSD. They became aware of chronic nightmares. And so people began asking more and more questions. What can we do about this? And you would see these articles appearing in newspapers, in media, on the internet. And the articles would be all the same. And it was really disturbing for me as a sleep doctor to see this. The article would say, well, this was a 25-year-old man who had recently returned from Iraq and was having trouble with his PTSD, trouble with insomnia, trouble with nightmares. And so the doctors gave him, an alphabet soup of medications. And then this is the media reporting the story and going, when the person didn't do well, so he came back to see the doctors and the nightmares were worse and the insomnia was worse. And so they increased the medication. Now, these stories never, ever, not once, said the patient was referred to a sleep doctor for those nightmares, for those insomnia, to be evaluated for that condition. Instead, the last part of the story is the patient either killed themselves or the patient died in their sleep for sometimes unclear reasons. And as a sleep doctor, we know that many of these patients have either or both treatable conditions like nightmares, insomnia, that if targeted and offered to the patients, give them immediate respite and relief, because now they're going to start sleeping better. The second part is many of them had undiagnosed, undetected, unrecognized sleep apnea. And that's what we found in our research over and over again. So we're talking about all of these things are happening to these people. And that means all that brain cleansing we talked about at the beginning, that's not happening. They've got nightmares, insomnia, and sleep apnea. How is their brain supposed to be get cleaned at night? How are they supposed to have the good and healthy brainwashing? They're not. And when so that leaves this waste product building up inside the brain, for one. It also means they're not getting rested. It also means their body It does not feel like it has proper energy. Well, all these things are a setup for somebody to feel like they're just not going to get better. They're always going to be sick. That's going to lead to depression. And of course, depression is the single greatest risk factor for somebody who may eventually go on to attempt or sadly complete suicide. So this connection is huge. There's a little bit of research, coming out now where people are talking about let's treat their nightmares and see if the suicidal thinking gets better. Let's treat their insomnia. Let's treat their sleep apnea. But nothing compared to the enormity and the pervasiveness of the problem. In other words, just a quick example. If somebody were admitted to a mental health facility, whether it's inpatient or outpatient, and they said that they were suicidal in any way, I'm saying every single one of those patients, every single one, needs a sleep evaluation at a basic level to find out if they have nightmares or insomnia or both. And every one of them needs a sleep test. And nowadays it is so easy to do a sleep test. They call them home sleep testing. They just advertised a new product on the market just a week ago, I think, where it's a ring. You can put a ring on your finger and it'll evaluate your oxygen levels, which is not a perfect test, but it gives you some idea. I'm saying all these people need this evaluation, this testing up front, not weeks later, not months, not a long time. Right when they tell somebody they're suicidal, you ask, is there something wrong with your sleep? And you're going to find out somewhere between 70 to 85% of those people are having active sleep problems and nobody's talking to them about it in any detail.
Well, you mentioned your books, so tell the listeners about your books and how to get them and what they can expect when they read them.
Well, the most recent book is available everywhere. You can get it on Amazon. It's wherever books are sold. It's called Life Saving Sleep. And the subtitle, speaks to what we've been talking about, New Horizons in Mental Health Treatment. And the goal of this book is to help basically, four different groups of people. There's the patient, there is the partners, spouses of the patients, and there are the doctors, and the doctors then have their relationships with the patients. So three people in all, three groups in all, but the patients obviously factored in twice, both personally and professionally. The book is written for all of them because it walks them through this fact that we have so poorly described and defined the nature of sleep problems. At the very beginning of the book helps people understand that sleep quality is where it's all at. And that by focusing on sleep quality, you can begin to ask yourself a series of questions like, how do I feel in the morning? How much caffeine do I need during the day to get by? What's my energy level like in the afternoon? How are my cognitions of memory, attention, concentration holding up at my work, holding up in my conversations with people? What is my mood like? How well do I cope with my emotions? All these things that we tend to not connect to sleep all help us begin to understand, well, wait, maybe I have a sleep problem. And there's some other big ones, like if you wake up at night to use the bathroom, that's a sign of sleep apnea. If you wake up in the morning with a headache or a dry mouth, that's a sign of sleep apnea. If you've been diagnosed with high blood pressure, that's a sign of sleep apnea. So you can learn all about these kinds of links and keys and clues in the first part of the book. And then we go on and talk about the various different ways to treat sleep breathing disorders. And then we move into the section on the more psychological aspects and give a lot of tips and training on how you treat insomnia, and then how you treat nightmares, and then restless legs and leg jerks. And that's the largest amount of knowledge in the book because those are the most common conditions and the most overlooked by so many people in healthcare today. And even some sleep centers are not well equipped to understand how to evaluate these conditions at the most precise level to help the patients. I'll give you one quick example, which is that in sleep medicine, there's a term used sometimes called mild sleep apnea. And really, the term should never be used because there's probably no such thing as mild sleep apnea. It's just based on a bunch of numbers that somebody got on a test, and yet people in the profession look at the numbers and say, "Well, that's mild." I say, "Well, how do you know it's mild? Talk to me about what the patient is experiencing." That's where the action is. If somebody has a small set of numbers on their breathing, like they've got a few breathing events, and you go, "Well, that must be mild." We hear stories all the time of the doctor saying to them, "Well, you don't need treatment. Your condition is mild." But yet the individual is complaining of being tired and sleepy during the day. So I say, let's treat the so-called mild sleep apnea and find out what happens. And often what happens, the patient has a very marked improvement. So they would never say it was mild. So those are some of the kinds of stories that we would go through in the book, help people understand it's very important to, as I said earlier, to make a personally tailored approach to this problem.
Tell us about any current or upcoming projects that you're working on that people need to know about.
Well, the biggest one, and the one that I think is going to have a large impact over time, is that I began working about a year ago with the Gateway Behavioral Health program here in Savannah, Georgia, where they have a psychiatry residency training program. And to my knowledge, this is the first time that someone has formally brought a sleep training program into a psychiatry residency training program. So we started out by giving them some lectures. That was about a year, almost a year and a half ago, talking about various sleep disorders. But as time went on, we realized that they have so much on their plate in terms of the psychiatric evaluations they must do that we had to give them some clinical applications. So the last several months, we started a sleep clinic that began early this year, where we have a once a week program, and I'm working with one of the faculty members teaching them how to evaluate sleep patients. And the psychiatry residents are referring their patients to this sleep clinic. Eventually, the psychiatry residents will run the sleep clinic. And then the next thing that's happening in 2 weeks, we're going to be attending, that's the word we use in academic medicine, we're going to be present at an adult psychiatry clinic where many, many patients will be seen in the course of one day. Multiple psychiatry residents will be there, multiple faculty will be there. But the two of us, the other doctor I'm training and myself as the board certified sleep doctor, we're going to be there. So when the patients are talking to their psychiatry residents about their sleep complaints, now we're going to step in to the clinic appointment and expand on that conversation and help the psychiatry resident learn firsthand how to evaluate the patient. At the same time, of course, educate these patients on the need for further workup, testing, and treatment for their sleep disorders. So we think that's going to be a very big plus as we do more and more of this clinical work. And this will be happening at least once a month for this academic year. And then finally, the next academic year, we hope to do even more of this implementation, depending upon how the need is identified.
Well, throw out your contact information so everybody can keep up with everything that you're up to.
Sure thing. My main website is barrycracomd.com. And on that website, there's several resources. There's several free videos that talk about aspects of sleep. There's some books and videos on the treatment of chronic nightmares. My other books are listed there for sale. And then I have what's called an innovative coaching service. And I developed this because so many people have been frustrated in their experiences, either with other sleep centers or other healthcare professionals, whether it's primary care or mental health, and they're not really getting the information they need. So instead of treating them, I coach them and educate them. And people can sign up for a coaching appointment at that website, barrycracomd.com. The last thing, I have a new free newsletter anybody can sign up for. It's at this new platform called Substack. And my address is fastasleep. That's one word, fastasleep.substack.com. And I usually have something posted there once a week on either new information, new research findings, or sometimes various podcasts and interviews I've done regarding the life-saving sleep book will show up there as well.
Okay, well, close us out with some final thoughts. Maybe if that was something I forgot to talk about that you would like to touch on, or just any final thoughts you have for the listeners.
Sure thing. I would say 2 points that are very good tips for managing sleep problems. One is for the psychological part, one is for the physiological. If you have insomnia, it's very important to try to understand whether or not you've reached the point where you're losing sleep over losing sleep. And that means that the sleep problem has gotten so bad that you're obsessing about it all the time. You wake up in the morning after, a bad night of sleep and you're wondering, well, is the same thing going to happen? What am I going to do today to make my sleep better? And then it gets towards evening time, you start thinking about it again. This thing is called losing sleep over losing sleep, and it actually can become dangerous. And it clearly interferes with any treatments you're going to try to work on. I write about this extensively in my book, Life Saving Sleep. And it's very important to understand that if you're on that track, you've got to get off of it, because that will make it almost impossible to be able to overcome your insomnia, because the obsession now has made everything worse. And it, of course, is not easy to break that obsession. Sometimes you do need to work with a professional to do that. So that's a very important point, losing sleep over losing sleep if you are suffering from chronic insomnia. On the physical side, many people are scared when they hear about sleep breathing disorders. They think about stopping breathing and choking and so forth. And there are some cases like that where it's very severe. But most people with a sleep breathing disorder, it's not so obvious. That's why it's often difficult to diagnose. But the thing that I've found over the last few years, it's very interesting, very empowering for the patient, is that you can do something quickly, easily, and early to treat yourself for the sleep breathing condition and actually figure out what's going on by the treatment effect. Let me give you a simple couple of steps. Suppose you go out and buy nasal saline sprays, or you buy these things called nasal strips, or you buy other things called nasal dilators. If you were to use any of those things and you notice that your nasal breathing starts to improve, and then you notice that your sleep starts to improve, you've got about a 90% chance that you've just diagnosed yourself with a sleep breathing disorder. And that's really good news then, because it means you've already found a simple treatment that's making things somewhat better. Hopefully then that motivates you to say, well, how much better can this be treated? And the answer is a whole lot better, because there's all kinds of other treatments out there, whether it's PAP machines or dental devices or surgeries. And so just by taking these little, what we call baby steps, nasal saline sprays, I have a whole video series about nasal breathing and nasal sprays. It's free on my website, barrycracomd.com. And if you go down these pathways and you're saying, this is helping me, well, that's tremendous early intervention for a problem that really, if you change it, it could change your life. So those are the two areas I think people are good takeaways because they can apply this information pretty quickly.
All right, ladies and gentlemen, barrycracomd.com. Be sure to check him out. If you know of anybody that's having any sleep issues or sleep disorders, please share this episode with them. Also, do not forget to follow, rate, and review so I can keep bringing you great content like this. If you have any guest or suggestion topics, cjackson102 at cox.net is the place to send them. As always, thank you for listening. And Barry, thank you so much for joining us.
Thank you very much, Curtis.
For more information on the Living the Dream podcast, visit www.djcurveball.com. Until next time, stay focused on living the dream.